You're watching TVC News at 10. The Nasarawa State Government has appealed to striking health workers at the Dalhatu Araf Specialist Hospital, Lafia, to accept 20% of their salaries as hazard allowance and return to work. The health workers had embarked on a 7-day warning strike to demand their hazard allowances as frontline workers in the fight against coronavirus. Godwin Agwam reports.
On the 9th of June 2020, health workers under the umbrella of the Joint Action Committee of the Dalhatu Araf Specialist Hospital began a 7-day warning strike. The federal government had promised an added sum of 50% of salaries as hazard allowance for health workers in the front line of the coronavirus fight. Now, these workers are demanding for the domestication of the federal government scale for its workers.
We are looking for the domestication of the special allowance and special incentive for the COVID-19 management. And we gave them an ultimatum of which, if nothing is being done before the expiration of the ultimatum, we will embark on 7-day industrial disharmony. And this ultimatum elapsed on the 12th midnight of Tuesday.
The strike action of the health workers has granted major operations in the hospital. Most laboratories, theaters and wards were seen under lock and key as there was no worker to man them. A few health volunteers and medical consultants were seen in the hospital in the event of an emergency. But the management of the hospital say the government is not buoyant enough to pay 100% of the hazard allowance. They are ready to offer 20% of salaries as hazard allowance to the striking health workers.
50% of basic salary as hazard allowance, and our government has given 20%, as that's what the government can afford now. So I think the government has tried. There are a lot of states that have not even made that offer. There are states that are given less than 10%, and the government has made 20%. But still, the negotiation is ongoing.
The management is appealing to the striking workers to shed their swords and return back to work, as the services are needed more at this period of the coronavirus pandemic. Godwin Agwam, TVC News, Lafia.
Well, Godwin joins me now for more on developments in Nasarawa State. Godwin, indeed, health workers play a very critical role in the fight against COVID-19 at this time. Now the state government has mentioned what it can do, but are the health workers buying into the government proposition?
Well, Ambassador, thank you very much. It's important to state clearly that the Dalhatu Araf Specialist Hospital here in Lafia, the capital of the state, is one of the tertiary health institutions we have in the state here. In fact, it's one of the few centers designated for the treatment of coronavirus in the state. It's unfortunate that I woke up to the news that the Joint Action Committee of the Dalhatu Specialist Hospital, this comprises of the Association of Resident Doctors, the National Association of Nurses and Midwives, the Pharmaceutical Council of Nigeria, and the Society of Pharmacists in Nigeria, and a host of others gathered together to embark on a 7-day warning strike. What they are demanding for is 50% of their salaries as hazard allowance, as approved by the federal government. They are insisting that the state government here should domesticate the scale provided by the federal government. But the management of the hospital and the state government here are saying that they do not have such funds to pay 50% of their salaries as hazard allowances. Rather, they are appealing to the workers to accept 20% of their salaries as allowances or hazard allowances. But the workers are saying no to it, that they have to pay them what the federal government has approved. The management are appealing to them, telling them that they do not have such fund at this moment, especially with the way the economy is at the moment, that they should accept the 20% and come back to roundtable for
So
further
Godwin,
negotiation.
as it is now, we are waiting for the response of the Joint Action Committee of what they would do in this particular matter. Thank you very much for talking to us at this time.